we have the tools to save lives and end COVID-19 as a global health emergency this year. We must continue to use them all and use them well. On Friday, the Emergency Committee for the Global Outbreak of Mpox met to assess whether, in its view, the outbreak remains a public health emergency of international concern. The committee has advised me that, in its view, Mpox remains a global health emergency, and I have accepted that advice. The committee acknowledged the progress made in reducing Mpox transmission globally and the continued decline in reported cases since its last meeting. However, more than 30 countries continue to report cases, and the possible underdetection and underreporting of confirmed cases in some regions is concerning, particularly in countries where animal-to-human transmission of Mpox has been reported before. WHO continues to call on all countries to maintain surveillance for Mpox and to integrate services for prevention, preparedness, and response into national control programs, including for HIV and other sexually transmitted infections. The earthquake in Turkey and the Syrian Arab Republic, Marburg in Equatorial Guinea, and the ongoing COVID-19 pandemic all point to the need for all countries to build health systems that can withstand the shock of emergencies and deliver the care people need when they need it most. Christian, back to you.
Thank you very much, Dr. Tedros. And we will now open the floor to questions. Let me remind everybody again to raise your hands with the raise your hand icon in order to get into the queue. And we'll start with Helen Branswell from Stats. Helen, please go ahead.
Thank you very much, Christian. My question is about the Marburg outbreak. Has the Institut Pasteur in Senegal managed to type or sequence the virus yet? Do you know which strain of Marburg it is? Thank you.
Thank you very much. And I believe we have Dr. Anna Maria Restrepo online. So please go ahead.
I think this question is for Dr. Abdi Mohamed.
Thank you, Anna Maria. Then we'll go to Abdi Mahmoud, the Director for Alert and Response Coordination.
Thanks, Helen. I would like to take this opportunity to acknowledge the excellent support from IP Dakar. The team have been working overnight, and we expected the result to be released today. We were told that we're still waiting from them. Indeed, they did 2 PCR tests, which both of them showed that tests were positive. And so hopefully within the coming hours or tomorrow, we'll be able to get the sequencing results.
Thank you very much, Dr. Mahmoud. Next question goes to Ashley Furlong from Politico. Ashley, please go ahead.
Thank you for taking my question. My question is to Dr. van Kerkhoff regarding her comments to Nature on the Origins investigation. When you said that the plan has changed on the work being done and that there's no phase 2 to this work, I was hoping you could clarify what you meant. As I understand it, the WHO press office is saying that while the investigation is stalled, it's not abandoned. I was hoping just to hear you elaborate a bit on what you meant in that interview. Thank you very much.
Thank you for that opportunity to clarify. And Dr. van Kerkhoff, please.
So thanks very much for